Hello class, welcome to week 3, module 3. We're going to go through chapter 3 of your text, which is over dispensing medications. Our chapter topics are to go over prescription, the correct drug administration rights, dosage forms and routes of administration, factors that influence drug action, teaching patients medication management, medication safety, and understanding the prescription. Our running objectives are to describe the components of a prescription, state commonly used prescription abbreviations, explain the rights of correct drug administration, recognize common dosage forms, name the routes of administration and their abbreviations, recognize factors that influence the effects of drugs, particularly in older adults and pediatric populations, and describe the role of the pharmacy technician in medication. So first off, a prescription is a direction for medication to be dispensed to a patient written by a physician or qualified licensed practitioner and filled by a pharmacist. The term isn't used in institutional settings. This is just for basically an outpatient scenario where you would take a written prescription to a retail pharmacy and have it filled. A medication order is the prescription used in an institutional setting, such as a hospital. So here's an example of a written prescription that you would get from your physician and take to your retail pharmacy. There's different components. First, we have the patient's full name, the date the prescription was written, which is important because a prescription is only good for 1 year from the date that it's written. 3 is the drug name. 4 is the dosage. 5 is the route of administration. 6 is the amount of drug to be dispensed. It's important to note that amounts should be written out to prevent alterations, especially on a controlled substance. The next is the signature of the person authorized to prescribe, such as a physician, physician's assistant, or nurse practitioner. If you have a controlled substance, you need to also include, or they need to include, and you need to check for the DEA number down here, usually down on the bottom underneath the doctor's signature. The generic, if a physician or prescriber is permitting generics, that needs to be checked. And then if there's any refills, that needs to be included as well. As you work in a retail setting, you will know what to look for and checking a prescription, and if it's all of its pertinent information will just become commonplace to you. Again, as we went over in the previous slide, the components of the prescription are patient's name, the date the prescription was written, the inscription, which includes name of drug, dose, quantity of ingredients, the SIG codes, which are the directions for use, number of refills or no refills, signature and address of the physician, indication of whether generic substitution is permitted, and the DEA number for the prescribing physician or PA or nurse practitioner if it is a controlled substance. There's different abbreviations that are used on prescriptions. The standard usage for prescribers, pharmacists, and prescriptions. It's not used for patient instructions or verbal orders. That's important to remember if you are talking to a patient. You're not going to say 1 tablet PO. They're not going to know what that means. That's just for medical professionals. It can also be a potential source for medication errors, so we need to be really careful with those. This is a list of do not use abbreviations. Most of the time, prescribers are going to adhere to this. Sometimes, well, when I worked retail, it was a while ago, but I worked retail for 12 years, and even if things were on the do not use list, some prescribers would still use that. The reason that they don't want you to use them is because they can often be mistaken for other SIG codes. So, for example, the IU, international units, depending on a prescriber's penmanship, it could be mistaken for IV or for 10. So that's why it's always good to write out the instructions specifically. All right, so what is the SIG on a prescription? The SIG is the directions for the patient to follow when taking a medication. And again, my chair is really squeaky, so I'm sorry if you hear that. Is it acceptable to have a prescriber's signature stamped on a prescription? That would be a no. The prescriber needs to either handwrite it or have an electronic one from an e-prescription. Um, so we're going to discuss correct drug administration rights. These are to be used as a guideline for filling prescriptions and concepts used to avoid medication errors. If something seems strange about a prescription, like a dose, speak up. As a pharmacy technician, you are a valuable asset to your pharmacist. Your pharmacist will be glad you express your concern. The longer you're working in a retail setting, the more comfortable you're going to be pointing out things that look odd. That just comes with time and with practice. These are things to consider if you are working in a retail setting and you're inputting prescription information into your computer system. Just check out for these things, that you have the right drug, the right strength, the right route, that you have the correct patient, and the right documentation that's pertinent to that prescription and that patient. So we're going to talk about determining the route of administration. Things to consider: the disease state, the area of the body, the drug's chemical composition, the patient age and condition, and convenience. So the most common that you're going to probably see in retail are PO routes, which is by mouth. There's sublingual or under the tongue, oral to be swallowed, and buccal, which dissolves in the cheek. That one's not very common. Most of the time you're going to see oral or sublingual doses. Oral dosage forms include capsules, elixirs, gels, powders, solutions, suspensions, syrups, tablets, and troches or lozenges. Your book does go over those in a little bit more detail. You also have parenteral routes, which basically just means not by mouth, something that isn't going to be absorbed by the GI tract. So you have the intramuscular, intravenous, intradermal, subcutaneous, and intraspinal or intrathecal. These intraspinal and intrathecal doses are generally used in a hospital setting, as well as most IV medications. Sometimes you'll have those in a retail setting as well, but they're not very common. So you have two different types of parenteral dosage forms: solutions and suspensions. Examples of a topical route are transdermal inhalation, ophthalmic, which means in the eye, otic, which means in the ear, nasal, rectal, and vaginal. Your topical dosage forms are aerosols, creams, emulsions, enemas, gels, inhalants, and lotions. Ointments, paste, powders, sponges, sprays, suppositories, and transdermal patches. So provide the route of the following group of dosage forms: capsules, powders, solutions, and gels. Those are oral. And provide the route for the following group of dosage forms: creams, lotions, sprays, suppositories. Those are topical. Special considerations in older patients. Older adults have special needs in relation to their medications because aging affects both the chemical reactions that administered drugs undergo in the body, or the pharmacokinetics, as well as the body's reaction to the drugs, which are pharmacodynamics. In addition, older adults have more chronic diseases than young people do, and they also intend to use more drugs, both prescription and non-prescription. 4 out of 5 older adults have at least one chronic disease, and many in this age group take numerous medications 3 to 4 times a day sometimes. So for some older adults, medication can support their independence and help them lead independent lifestyles, and as a result, geriatric medication has emerged as a new and important medical specialty of the healthcare system. The changes in physiologic function in older adults include visual changes, auditory changes, gastrointestinal changes, pulmonary changes, cardiovascular, renal, hormonal, and body composition changes. They also have altered drug responses. Their absorption, distribution, metabolism, and elimination changes can be altered as you age. Normally, blood flow as measured per minute decreases about 1% per year as an individual ages, beginning about 35. thing to consider with older adults is adverse drug reactions, Beers list, polypharmacy, which is one patient taking multiple medications, cognitive abilities, and non-adherence. With the altered drug responses, the body weight commonly used for drug doses needs to be considered. Over-the-counter doses for very small or young children that aren't on the packages. Calculations need to be double-checked, and doses need to be reevaluated regularly. For pediatric patients, there's usually a check and a double check when writing a prescription, just to make sure that the errors are cut down. So another thing to consider with pediatric patients and dosages are allergies or hypersensitivity of the immune system induced by exposure to a particular substance. Allergens are substances which cause the allergic reaction. Histamine, which is produced by the body in response to an allergy. Signs of allergic reaction, which are red, watery eyes, sneezing, urticaria, rash, bronchial constriction, and allergy documentation that needs to be part of the medical record for every patient, not just pediatric patients. In your pharmacy, you need to compile a list of drug allergies and drug sensitivities on each patient. The role of the pharmacy technician with medical management is provide clearly written directions, record medication history and profile, including use of OTC medications, explain that pharmacist is available to answer questions and provide instructions. That needs to be provided for every new prescription. Pharmacists need to be available to counsel patients. Read exact wording on a label, medication guide, or educational materials to patient. Ensure that patients know how to read the medication labels. And by law, pharmacy technicians cannot advise or counsel any patients on new medications, but we do need to encourage the patients to let a pharmacist advise them or counsel them on new prescriptions. These are called auxiliary labels. As we mentioned in Chapter 2, there's multiple auxiliary labels that are available at retail pharmacies and inpatient hospital pharmacies that need to be applied to applicable prescriptions. The most common ones that you're going to use are this red one here that may cause drowsiness, dizziness, and then the take with food. And then if you have any kind of topical medication, then you need to include this for external use only as well. Those are just things that you're going to have to learn as you practice. When a pharmacist checks the prescription, if you've missed an auxiliary label that's pertinent to that medication, the pharmacist will just usually add that for you or instruct you to add one as well. So there's different reasons for non-adherence. Side effects, failure to understand the disease, confusion or complexity of the regimen, and simple forgetfulness often occur. The Risk Evaluation and Mitigation Strategy, or REMS program, is mandated by the FDA for certain medications, and the goal is to ensure that benefits outweigh risks. Potential requirements are dispensing a medication guide, special dispensing and or prescribing requirements, completion of training by prescribers and pharmacists, and special dispensing procedures for technicians. If you've ever gotten a prescription from a retail pharmacy like Kroger or Walmart, a lot of the medication guides automatically come with any prescription that you're going to get. When you pick up a prescription, it's like it also comes with a book. Those are just the medication guides that that include prescription information such as side effects and things like that. The technician's role is to verify the patient's address, date of birth, phone numbers. You can go back and look at that previous slide. It's just verifying a lot of the information on the patient. Make sure that you have the correct patient when you're inputting prescriptions. Dispensing cautions is a requirement to use original containers, and partial prescriptions aren't allowed. Tamper-resistant pads, reimbursement for prescribers who file for Medicaid reimbursement. If they're not used, prescriber will get a call to verify prescription, and intent is to encourage e-prescribing. When I was in retail, Only a handful of doctors in our area were using e-prescribing, but it is much easier because everything is typed and you don't have to guess what physicians or prescribers are writing. Medication reconciliation, improvement of patient safety during transactions of care from one level to another, and purpose of reconciliation is to communicate drug therapy information to the next care setting. Goals to keep in mind. Obtaining certification as a pharmacy technician. Most pharmacies are going to require certification anymore. That's different from state to state, but I believe in Kentucky almost all pharmacies require certification. Um, it also helps you secure employment in this profession. Resourceful organizations include Pharmacy Technician Certification Board. That is who is going. That's the accrediting body that you will take your exam through, and also who you will complete your continuing education through. They issue your license. The American Association of Pharmacy Technicians and National Pharmacy Technician Association. In summary, a prescription is a request for dispensing of a medication. The rights for correct drug administration are the right patient, the right drug, the right strength, the right route, the right time, and the right documentation. The three main types of administration are oral, parenteral, and topical. Several physiologic changes occur in older adults, leading to altered drug responses. Drug doses in children are most often calculated using patient weight, and a pharmacy technician plays a positive role in influencing drug